Thanks so much. Thanks to Elizabeth. Thank you so much to Len and Lori for getting the discussion going. Thank you to Sylvia and Jeff in the background and the rest of the PSA group who is helping us run these presentations so smoothly. And big warm welcome to everyone living with pain who is able to join us today. We're so happy to have you here. So in this presentation, I'm going to give a very brief sort of how-to presentation for helping people with chronic pain cope with grief and loss. In my work at the Chronic Pain Center, discussions around grief and loss are our bread and butter. And I can recognize that for a lot of other health professionals, it's not, and it can be a difficult topic or the elephant in the room to discuss. So I'm hoping that in the next 10 or 15 minutes, I'll be able to give at least some pearls to help navigate this important topic. So for healthcare providers, step one for helping your clients cope with loss and grief starts with yourself. Acknowledging, recognizing grief within your own life is invaluable. I know this from experience, having lost a parent just before starting my training in clinical psychology. I very quickly realized that until I was able to work through my own grief, I wouldn't be able to hold the space for someone else. And this idea of being present and holding space is something that we have heard throughout this conference. I'm going to get to in a moment. But unresolved grief within the healthcare provider takes up space in our minds and hearts that prevents us from holding the space for other people. So really working through your own grief is step one, if that's applicable. I would say that one of the most common things I hear from other healthcare providers about what makes talking about loss and grief so challenging is that it's a difficult conversation and a lot of providers just don't know what to say. You're hearing something very potentially difficult, challenging, maybe one of the most dark periods in somebody's life, and that can be really difficult to know how to respond to. And so I implore every healthcare provider here to ask and acknowledge that grief might be an important part of somebody's experience with chronic pain. If you don't know, or if you don't ask the question, we won't be able to provide the comfort. Len, I'm trying to remember the quote properly, but Leonard had just talked about that we first need to understand what is being comforted before we can comfort that person. So we do that by asking. So if you don't know what to say to someone, you can say that, I don't know what to say. And you can just validate and reflect back to the person. You know, I hear that you've experienced profound loss, and just listening, reflecting, sometimes not saying anything at all, and just leaning into the person, making eye contact, being present, sometimes taking a deep breath. Right now, I don't think you can see it, but I've got my hand to my heart. I'm leaning forward and just active listening, showing the person that you are there for them. You're not trying to provide any corrective feedback. You're not trying to provide any advice. Is so powerful. We heard Lori talk about that just now, just somebody to be beside you, somebody to support you, not trying to give you advice on what to do can be so powerful. And of course, allowing the client to tell their story without interruption, without inserting your advice, without inserting your own experiences with loss and grief, and so on. And so this holding space idea is something I've heard throughout the conference. Dr. Sam Parmiter, who is a pharmacist who was talking about opioids yesterday, he talked about the importance of listening to the client's story, holding space. Dr. Yo, who is an anesthesiologist working in the transitional pain program, talked about being present, person-centered care, holding space. Lori talked about that just now in this morning's presentation. around the medicine wheel, we talked about the importance of the relationship and holding space and being present for your client. So this is a theme that hopefully people are seeing again and again. So after we sort of ask about and acknowledge the losses in chronic pain, important to also provide some key messages about grief. So just sharing with our clients that grief is a normal response to loss, that there is no right way to grieve. Although two people with chronic pain may experience similar losses, their grief responses might be very different. Grief does not have a timeline. And one of the most important things is that the goal of discussing grief or providing grief interventions is not to get over the grief or go back or rebound to your old life, but rather integrating the loss into a new life that incorporates these experiences with loss and grief. Now, one thing I'd like to highlight is that with the third point here, that no two people kind of experience grief the same way. Something that's coming up increasingly in my practice at the Chronic Pain Center is the experience of young adults and or emerging adults who have chronic pain. So I think the healthcare community, certainly the scientific community, is realizing that, we have a children's hospital, we have pediatric pain programs, we have adult pain programs, but there's this middle group of emerging or young adults who, when they experience chronic pain, may experience their own unique set of losses. So an example comes to mind where a young person was sitting in one of our pain coping CBT groups, was looking around at all the middle-aged and older adults around them and reflected back, these other people, these other participants are talking about all the losses of the way things used to be. I used to be able to do this. I used to be able to do that. Whereas this person's losses were really around potential and the loss of a future life. And I thought that was a very interesting reflection, and maybe just something for us healthcare providers to be more aware of, that for this special group of emerging adults, there may be some unique types of grief and loss. So I know that Len presented a model of grief from his clinical experience. I'm going to share a model of grief called the Pathways Through Grief model. This is one that we teach to our patients at the Calgary Chronic Pain Center. And it's similar to what Lori just described with her grade 3 student who felt like she was in several pieces of the grief process at once. So you can see that this model is shaped like a figure 8, and it suggests that there's no starting point or end point. It's not a linear model. There are no steps or stages. There's no prescribed progression. Rather, it's open-ended and flowy, suggesting that anyone can flow through these stages in a continuous way. So the top half of the 8 is things like it being exploring your options, exploring your treatment options, exploring what a world might be like after experiencing chronic pain. Things like investing in your life, incorporating chronic pain into your life, having hope that you can have a future that includes high quality of life and chronic pain. Again, it's not a hope to get over it. It's not hope for a cure. It's investing in your life, exploring what life might be like, having hope that you can have quality of life with the losses and with the grief and with chronic pain. At other times, folks might be experiencing the emotions at the bottom half of the 8, protesting against the way things are, feeling despair, feeling detachment from themselves, from their bodies, from their loved ones. And these stages, again, flow continuously, maybe even moment to moment. And what really sort of helps people transition from the lower part of the 8 into the higher part of the 8 is meaning. and how we attribute meanings to our experience. This is really the meat and potatoes of my work when people are coming to me with grief, is trying to make meaning, make sense of all of this. And so I had a client who was a very ambitious go-getter, who managed their own work, who managed caring for a loved one who was living at home with them, who also had their share of health problems. And then my patient developed chronic pain and felt so despairing that they could no longer live this very busy, hustly, bustly life that they used to, and felt that God was punishing them for maybe having some shortcomings. And then their loved one that they were a caregiver for died. And through that experience, this patient came to me and said, you know what? I think God gave me chronic pain so that I would slow down and spend time with my loved one at home, so that I wouldn't be spending all my time at work, so that I wouldn't be going to these meetings and traveling, so that I would be home with my loved one. And maybe that was God's way of slowing me down so I could spend my loved one's last few months with them. And wow, that was powerful. And from there, with that new meaning, they developed so much more hope and forward thinking. And that's just one example of how changing your understanding of the chronic pain experience can really help someone flow through this model. So in the last couple of slides here, I'm going to try to keep us as on time as possible. I'd like to share some first informal grief interventions, and then I'll talk about some evidence-based grief interventions, more kind of psychological, maybe structured interventions. So the first informal intervention is social support. Again, we've heard this so many times throughout this amazing weekend, that spending time with friends and family, spending important time with spiritual leaders, with healthcare providers, that connection is so important. And a term that I hadn't heard of before this morning was relationship-based care. We talk about patient-centered care, we talk about person-centered care, but I loved learning this new framework of relationship-centered care and how important that is for folks with chronic pain. We heard Lori talk about how she felt scared to talk with her husband about her experiences, but yet the loneliness was so immense. So when faced with this teeter-totter of feeling like you must withdraw, like you're not the same, your friends aren't there for you in the same way, yet this immense isolation and loneliness, encouraging social support can be so powerful. Another grief intervention I strongly recommend are support groups, to be around other people who get it, to get a real genuine sense of empathy, a sense that you're not alone, an opportunity for gaining new insights and coping skills. And then also inviting or encouraging patients to explore any spiritual beliefs that might support their recovery or their work through, sorry, I take that back. I don't mean recovery from grief. I mean their work through the grief experience. So if there are any spiritual or religious leaders that might be important in that person's life, for the healthcare providers, make sure you're asking about that, because that can be so important. Again, in our conversation in the presentation this morning, we heard about how traditional wellness is so important for our clients. Also, it's not on the slide here, but in hearing Dr. Leif Haas talk about the importance of nature and getting outside, I don't know the literature on this, but I can imagine there's a literature on the benefits of nature for people who are experiencing grief. And then some other evidence-based psychological treatments for grief. Again, I want to highlight that the goal in going through quote unquote treatment for grief is to have quality of life with loss. and chronic pain, not to get over it or rebound or go back to the way things were. So acceptance and commitment therapy, or ACT, is an evidence-based strategy. CBT certainly is. And importantly, MBSR has been, or mindfulness-based interventions have been shown to be beneficial in later stages of grief, to help cultivate a non-judgmental stance towards challenging thoughts and emotions. But if somebody is a novice mindfulness practitioner, and you've heard, the media has led you to believe that mindfulness is a panacea that can help anyone and everyone. For novice mindfulness practitioners, we wouldn't recommend starting a mindfulness practice in the early stages of grief, because that can actually elevate anxiety, increase awareness of difficult emotions, and without the skills to do something with those emotions, it can actually complicate grief. So while mindfulness has been shown to be helpful for later stages of grief, it's something that I would recommend and the literature recommends we don't actually get started with right away. We would start with something like ACT or CBT, or even more just general approaches like social support groups, and so on. Okay, so my very final thoughts are that something that struck me in my work at the Chronic Pain Center is that there's no systems in place for people who have chronic pain who are experiencing loss and grief. When there's the loss of a loved one, for example, there's a funeral, there's a meal train, there's a wake, people come to take care of the kids and give, people wear black, and there's kind of a bit of a process that we expect in some cultures to go through. But when the grief is related to chronic pain, you're just sort of expected to keep going. It's like this invisible thing where you don't really know what the process is. You're supposed to still take care of your kids. You're supposed to still go to work. You're making dinner. And so that can make it more challenging to know how to cope with loss and grief when there aren't really any expectations on how to cope. For healthcare providers, so important to ask about and acknowledge loss and grief in all individuals experiencing chronic pain, validating, helping clients make sense of their grief response, and offering resources. I'd also like to highlight that these ideas of person-centered and relationship-centered care really resonate with me, and holding the space, being present, taking the deep breath before the appointment, such important parts that we've heard now several times in different contexts that I'd really like to highlight and end my presentation on. So thank you very much. I'll stop there.